In this evening's health report, Shamela Pullen tells us about heat stroke.
It's the middle of summer and the heat is on. When temperatures rise, the risk of heat stroke increases. Heat stroke is a serious medical condition that happens when the body becomes dangerously overheated.
Symptoms of a heat stroke can vary depending on the severity, from intense thirst to fatigue to global headaches to feeling unwell with nausea, vomiting, muscle weakness, muscle cramping, all the way up to declining alertness and even seizures, coma, and focal weakness, meaning weakness on one side of the body, all the way up to death.
Some people are more vulnerable to the effects of extreme heat. For these groups, the risk of a heat stroke can be especially serious.
The most vulnerable individuals are those who have to have prolonged sun exposure as a function of their work, for example, construction workers. Others, the extremes of age, babies, the elderly, particularly if they have medical conditions that may limit their hydration, such as heart failure, kidney failure, or they may have mental or neurologic disorders that prevent them from seeking help or making the appropriate changes such as hydration.
Once you recognize the signs of heat stroke, seek medical attention immediately. While waiting for medical care, begin cooling the person with cool water, wet towels, or ice packs. But the best approach is prevention.
Take breaks in terms of your exposure to the sun. After 10 to 15 minutes, go into the shade. Be very aware of your hydration. Do not allow yourself to become the hint of thirst. Keep up with your drinking. Wear loose-fitting, cool clothes so that air can pass through, and this will form a cooling barrier between your skin and the external environment. Also be mindful of the fact that you can have overheating indoors.
With your health report, I'm Shamela Pullen wishing you good health.